Ivan McKee, followed by Elaine Smith. No more than 6 minutes, please.
Thank you, Presiding Officer. Lightburn Hospital in my constituency is a key part of the local community. It provides inpatient, outpatient and day hospital services and is the base for the local Parkinson's group. In August, Greater Glasgow and Clyde Health Board presented proposals to close it. As members will no doubt be aware, this is not the first time Lightburn has been threatened. In 2010, the Health Board made similar proposals. Indeed, those proposals were discussed at a meeting of the Glasgow City Council in November 2010, and the Labour councillors there supported that closure plan in order to save the sum of £500,000. As we all know, the Health Board failed to make the case, and those plans were overruled by the then Cabinet Secretary for Health, Nicola Sturgeon, in 2011. The Health Board had a meeting in August this year, 16th of August, which I attended, where they presented the paper making their case, they believed, for the closure of Lightburn. I attended that meeting along with the Save Lightburn campaign, and Jerry McCann from the campaign is in the gallery today. And I've also met separately, along with the Save Lightburn campaign and representatives of Parkinson's UK, with the directors of the Health Board to examine their case for closure in more detail. In my opinion, the board fails to make a case for the closure of Lightburn based on what they've presented. The data they present is misleading and incomplete, and there's no data presented to back up the board's key claims around improved outcomes, a key part of the board's argument for closure. Outpatient services are to move from Lightburn to a proposed new health hub in the East End, but with no timescale for its construction. The Health Board directs questions about this hub to the IJB, a case of integration being used as a vehicle to shift rather than share responsibility. And there's no clarity as to what measures will be put in place to cover the period between the proposed closure of Lightburn and the hoped-for construction of the new facility. And in the meantime, the Lightburn site has suffered significant underinvestment. Recently, parts were boarded up, signalling that the site and the patients it serves are not valued. Lightburn serves a community with a high proportion of elderly residents and low car ownership. And recovery rates are better when patients are closer to family and friends with frequent visits. The plan to relocate rehabilitation inpatient services to the other end of the city presents visitors with many transport challenges. This government aims to tackle health inequalities, partly through shifting resources to the most deprived communities. The Health Board's plan does precisely the opposite. It would move resources from an area which contains 3 of the 4 most deprived areas in Scotland. All of these points I made in the Chamber in the debate 2 weeks ago, and today I want to examine further plans for continuing community health services in the East End of Glasgow. The Scottish Government has rightly put integration of health and social care at the heart of its programme to improve health outcomes. It's transferred the lion's share of funds from health boards to integrated joint boards, the IGBs. The Glasgow IGB has taken over responsibility for the provision of community health services across the city. And unlike the Health Board, where 7 of the 27 members only are elected representatives, fully half of the members of the IGB are Glasgow City Councillors. It's the IGB which has to consider how community health services should be provided in the city. And in August of this year, the IGB considered this very subject. The answer was to invest £32 million in a new community health hub in the East End. Now, here I can help the IGB by offering them some free advice. The IGB could use their newfound powers and the funds that have been allocated to invest in and develop an existing site that already provides community health services to the people of the East End. In short, Presiding Officer, the IGB could site the new community health hub at Lightburn alongside the existing services there. The Health Board's... Sure.
Jackie Bailey.
Member will be aware that IJBs are complaining about being underfunded by health boards. Has he just shifted responsibility away from the Scottish Government onto IJBs instead of defending Lightburn?
Ivan McKee.
If Jackie Bailey had been listening to what I'd said through the first 3 minutes of my speech, I talked precisely about defending Lightburn. I'm working with the Save Lightburn campaign. I've written to local organisations and I'm committed to working to save Lightburn. And if you read the IJB paper, the IJB themselves have talked about investing £32 million in a new community health hub, and the IJBs have got the lion's share of the funding that goes to the health service across Scotland. You should read this document and see what it says. OK, so who's on the IGB that would make that decision? Chair of the IGB, Councillor Archie Graham, and 4 other Labour councillors, including Bailey Elaine McDougall, who represents the East Centre ward adjacent to Lightburn Hospital. The money's there, it's in their paper. The public engagement on Lightburn's future has now started, and I've written to local community groups and community councils to urge them to take part. And I'm in my last minute. I believe the Health Board's proposals for Lightburn to be flawed. The answer to shift the focus of service delivery from acute to the community is not to close a community hospital and move patients to a large acute hospital some distance away. The answer to tackling health inequalities is not to shift resources from the most deprived communities to the centre. The answer to improving outcomes for patients is not to move them away from friends and family, reducing rather than improving their outcomes. The answer to improving health service provision for the people of the East End of Glasgow is not this Health Board proposal. And I call on the IGB to step up to the plate, to invest in the Lightburn site, the money they're going to invest, the money they're going to invest in their own paper, the money they're going to invest in their own paper, to choose to invest that in the Lightburn site to continue to provide services locally in the community in line with this government's national clinical strategy.